As of 31st May, we received reports from the state of Adamawa indicating that a total of now 834 cases have been reported in the 2 LGAs that have been affected by this outbreak. The government of Adamawa, the State Ministry of Health, with support of partners, have really been working hard to profile the epidemic fully. To understand both the locations that have been affected and also to fully be sure that the numbers that are being reported are indeed accurate numbers indicating all the citizens that have been affected so far. In support of this outbreak, WHO has specifically deployed prepositioned commodities. These are both medicines as well as materials that health workers use to prevent themselves or indeed transfusion fluids. So we have sent all those commodities and prepositioned them both in the areas where the outbreaks are taking place as well as in areas that we think most likely may be affected later on by the outbreak. So those have been prepositioned in the health facilities in those areas. In addition, WHO has deployed about 39 staff so far to work with the Ministry of Health to make sure that we are able to contact trace all those who have been affected with this outbreak, to make sure that relatives, children, spouses, and others are also not equally affected, and also trace the likely sources, whether it's contaminated water or it is toilets, to trace where the likely source of the cholera is. So we have deployed those staff. Also, we have staff that are helping in doing risk communication to make sure that the public is fully aware of measures that need to be taken at their personal level and family level to prevent themselves from becoming victims of this outbreak. We also helped in setting up the treatment center for treating the cholera cases. But now our partners in MSF are now coming up to take it up so that to move. So we also continue to mobilize other partners that are slowly coming to help the government and work with us to make sure that really we can contain this outbreak. I think the main challenges for this response is that, as we are aware, this is the beginning of the rainy season. So the rainy season is not yet at the peak. So this outbreak has started right at the beginning of the rainy season. So we expect that as the rainy season proceeds, there will be other outbreaks. So indeed this outbreak, it will be made difficult to contain it. Because as really the contamination of sewage sort of systems and water sort of reaches a peak, really if we don't contain this outbreak quickly, we will be in more problems. And for us also as WHO, together with the Ministry of Health, we learned from similar outbreaks we had last year, especially in Bono and also in Yobe. And therefore we are employing the lessons learned from there to try to do those things that are necessary to quickly contain this one, so that it doesn't get to that level where we are unable to sort of contain it with the rain season peaking.